Hi, my name is Steve Akalis. I'm with Remote Rescue Training at the University of Utah. There's a big difference between providing medical care in a hospital or a clinic, providing medical care on streets like urban EMS, and providing medical care in wilderness environments. In this video, we're going to look at some of those differences and see how they might affect the patient care that we provide. How the differences between urban medical care and wilderness medical care affect you will depend where you are in that sort of chain of patient care. Maybe you're just out with a buddy or your spouse skiing or hiking or adventuring and you come across an injured person. Maybe you're formerly on a search and rescue team and you're specifically called in to help an injured person. Maybe you're the designated medic or doc on an expedition and you have that as your formal role. Maybe you're providing medical direction to a search and rescue team, to other responders who are in the field, and you're still working in the urban environment and you're interfacing with those groups. In each of these different roles you might find yourself, the differences between urban and wilderness medical care will affect you differently. Wilderness medicine, medical care, is loosely defined as being more than 1 hour from definitive care. There are certainly many urban places in the United States and throughout the world that would then be classified as wilderness, at least for terms of the medical care you would provide. And certainly you can be in an urban environment following a natural disaster, a tornado, a flood, an earthquake, and end up basically practicing medicine within a wilderness context. So don't think that you just need to be on Mount Everest or deep in the wilderness to have these sort of differences between urban and wilderness medical care come up. And throughout this short video, as I talk about wilderness medicine, keep in mind that I'm not only talking about remote environments. When we think about differences between urban medical care and wilderness medical care, we often think of the four main differentiators. These are time, resources, communication, and the environment itself. I've already talked some about time as in the time for the patient to get to definitive care, but there's more to the time element, the time differences, than just the time to definitive care. One is the time that it's going to take to access the patient. Even if you're on a formal search and rescue team and you're on a inside country terrain, as I am here, you still need to stage, you still need to make some sort of a plan, and then you need to ingress to the patient. That might be hiking, it might be skiing, maybe you'll be fortunate enough to go in with a helicopter. But those things all take time, right? So it's really unusual, even in this kind of environment, for you to arrive at the patient in less than an hour. Another significant difference in the time element between urban and wilderness medicine is the time that you're with the patient. This isn't like a appointment in your office where a patient comes in and you spend 10 or 15 minutes and they leave. From the moment you arrive with that patient, throughout your patient care until transportation begins, and all the way through the transportation cycle, you'll be with that patient. It's a much different experience to be with them that entire time. And then finally on the time front, there's the egress time, right? Even if you're using a helicopter, and it's not like we just clap our hands and helicopters arrive, even if you're using a helicopter, the egress is going to take a significant amount of time. All of these put us outside the proverbial golden hour, right? They all put us outside of that golden hour. And it's some of the reason why sometimes in search and rescue or in wilderness medicine, we'll say that our patients are either stable or dead, right? Because if they weren't medically stable when we got the call, they were already unstable when we got the call. By the time we reach the patients, it's doubtful that they will have survived. Certainly, it's a cliche, but cliches become so because there's an element of truth with them. Okay, I've talked about the time element, sort of the differences between urban and wilderness medical care. Let's look at the next one, which is resources. This is pretty obvious, right? In a hospital, you've got diagnostic gear and radiology and specialists and all sorts of equipment to help you provide for that patient. In the wilderness, it's quite likely you will be the only care provider. The only medical gear you have may be what's in your backpack, or maybe you end up going through your a patient's backpack trying to find medical gear to care for them. But you'll have a very limited amount of supplies. That does lead to the question of what supplies should we have with us? What goes in a first aid kit? I can't really delve into it in this session with you because it's really complicated by a lot of what ifs, right? Your environment, a lot of variables. But in general, we like to look at the people you might be caring for, what environment they might be in, what activities they might be doing, and what medical care they may need, right? So kind of what is that care that you may need to provide. Then we like to think, like, make a list of what gear would we like to have to provide for those ailments, maybe prioritizing that, how much we would like to have it. And then when we have this wish list, which is completely impractical to take into the field, we then look at that list and say, what in here might I be able to improvise, like splints or dressing, right? What things are really difficult to improvise, like meds. Actually, medical gloves are pretty darn hard to improvise. And sort of pare down our list based on that decision of whether we can improvise or whether we can't. And then we may ask ourselves, and what can we carry, right? What's practical to bring in, even if it's something we can't improvise and would like to have. That wraps it up for the resources side of things. It's pretty obvious, but it's important to keep in mind because it's a big differentiator between wilderness medical care and urban medical care. So we've got time and resources. A third common differentiator between urban and wilderness medical care is communication, or lack thereof, lack of your ability to communicate. Maybe you'll be fortunate enough to have cell service in the environment that you work. If not, maybe you'll be able to have a radio to radio. Maybe it's a sat phone, like maybe you'll have some comms with the outside world, but it's likely you'll have none. And it may be that you actually have to prepare a note that says where you are, what your patient's condition is, what your treatment plan is, what your evacuation plan is, and make a resource request and send that out with someone into the front country. And if you do that, you really don't know, right? Communication, you need to get a response back. In that case, you may not know that your message goes through, so you may need to make decisions without hearing back from the urban environment, other folks who are going to come and help you. Poor communication also makes decisions challenging, because especially should we stay in place and take care of this patient, or should we begin evacuation? And when should we begin evacuation? Those decisions are really hard to make if you don't know if you have other resources that are going to come in to help you, especially with your transportation out of there. So communication almost always plays a complicating role, sometimes a minor complication, sometimes significant, in wilderness medical care. Okay, talked about time, talked about resources, talked about comms, or the lack of communication. Let's talk about the fourth differentiator, which is the environment itself. Unfortunately, folks just don't seem to get hurt on bluebird days out in a nice meadow where there's a road nearby that we can carry them to. It's usually too hot or too cold, or it's steep, or it's windy. And these things affect our ability to get to the patient, right? Because we have to travel in these conditions of too hot or too cold, or it's snowy and we can't come in with a helicopter. They affect our patient care. Maybe your patient is going to be on a rocky ledge mid-face on a climb, and they affect our egress, transporting the patient out. Or maybe we just have to tramp through bushes or over rocky terrain. The environment is a dramatically complicating factor for us. Providing medical care in a wilderness environment can certainly be challenging, right? It's important to consider the effects of time, both the time it takes to get to the patient, the time you spend with the patient, and the time it's going to take to transport the patient to definitive medical care. It's important to think about how your limited resources might affect your ability to care for that patient. Right? It's important to think about comms or lack thereof and how that might affect your ability to care for the patient and your decision making while you're in the field. To think about the environment you might be in and how that physical environment might affect the patient care. These challenges are all things that can be overcome, right? These can all be overcome. But it's important to be prepared, maybe physically as having the right gear with you, but certainly mentally to be thinking about how these things will differ from the medical care you're used to providing and how you'll provide medical care within that environment.